So today, we're going to talk about something that's often completely overlooked, the experience of people who are both autistic and part of the LGBTQIA+ community. It's this space where two crucial parts of a person's identity meet, and honestly, it's a place where a lot of people feel unheard and unsupported. We're going to explore why that happens and what we can do to change it.
Okay, let's kick things off with this quote, because I think it really gets to the heart of the matter. Imagine fighting for years, maybe your whole life, to live openly and be yourself. The idea that you might have to hide all of that again, especially at a time when you're vulnerable and need care, it's a devastating thought. This really sets the stage for our whole conversation.
And that fear of hiding, that's where this idea of the double closet comes from. Think about it. It's the immense challenge of navigating two different identities that can, unfortunately, both carry a stigma. You're dealing with the world as a neurodivergent person, and then you add this whole other layer of navigating your sexual orientation or gender identity. It creates this really unique set of hurdles when it comes to just feeling safe, seen, and supported.
All right, so here's how we're going to break it all down. First, we'll dive into why this intersection is so invisible in the first place. Then we'll get into the very real fears this creates, especially around aged care. Third, we'll look at the serious toll this all takes on a person's well-being. And finally, we'll talk about what good, inclusive support actually looks like.
Okay, first up, the invisible intersection. Let's tackle that big question. Why is it that these identities, together, are so often missed by service providers, by communities, by pretty much everyone? Well, check out this statistic, because it's a big one. Research shows that autistic people are 2 to 3 times more likely to be transgender than the general population. We're not talking about a small overlap here. This is a significant community, and their needs often get completely ignored simply because most people have no idea this connection even exists.
And that lack of awareness, it causes real harm. It leads to people's identities being invalidated. For example, a person's gender identity might get dismissed as just a symptom or a special interest related to their autism, instead of being respected as a fundamental part of who they are. They end up feeling, as one source put it, disenfranchised and disbelieved.
Which brings us right back to that dual burden. The term second closet just perfectly captures this. It's the experience where having a disability can actually force you to hide your sexual or gender identity, meaning you're facing two potential layers of stigma and discrimination all at the same time.
So let's look at how these challenges can really build up and create some intense fears later in life. Imagine you're from this community and you're starting to think about aged care, a situation where you're going to be really reliant on other people for your day-to-day support. All of these issues suddenly become front and center.
So this is the question that just weighs so heavily on so many older LGBTQ+ adults with disabilities. You've spent your entire life fighting for acceptance, advocating for yourself, and now you have to face this new, incredibly vulnerable situation. What are you most afraid of?
Well, the research shows a really consistent and frankly heartbreaking pattern of fears. There's the fear of just straight-up discrimination from staff or from other residents. There's that profound fear of being forced back into the closet. There are huge worries about medical care, like a transgender person being denied their hormone therapy. Then there's the fear of losing touch with the community that's been your lifeline, or staff just assuming you're straight and cisgender, basically erasing a huge part of your identity.
It's probably no surprise that living with these constant fears and just the daily reality of navigating a world not built for you, well, it takes a toll, a serious, measurable toll on a person's physical and mental health. And this isn't just a feeling, it's something we can actually see in the data. A study published by the National Institutes of Health found some really stark health disparities. When you compare autistic LGBTQ+ people to their straight, cisgender autistic peers, the LGBTQ+ group reports way more unmet healthcare needs and more days of just poor physical and mental health. Let's break that down even more. What the data shows is that the effect of holding two marginalized identities sort of multiplies the challenges. The autistic LGBTQ+ group had more co-occurring disabilities, more co-occurring mental health conditions, more sick days, and, as we saw, more of their healthcare needs were just not being met at all. So you have to ask, why? Why do these huge gaps exist? It's not a coincidence. There's a theory called minority stress that really helps explain it. The basic idea is that living with constant stigma, prejudice, and discrimination creates this hostile, incredibly stressful social environment. And over the course of decades, that chronic stress literally takes a negative toll on your body, leading directly to the health problems we see in the data. Okay,
So we've laid out the problem, and it's a serious one. But what do we do about it? Let's switch gears and talk about solutions. Let's look at what the research says best practices for truly inclusive care actually look like.
Now here is one of the most powerful findings. Big structural change works. That same NIH study found that in states that have laws on the books specifically prohibiting discrimination based on gender identity and sexual orientation, autistic LGBTQ+ people had fewer unmet healthcare needs. So policy isn't some abstract thing. It's a real protective factor that has tangible health benefits.
And on a more practical, on-the-ground level, we can boil down the recommendations into 4 key pillars for creating safer spaces. 1. Training and competency. You have to educate staff. 2. Creating welcoming environments with things like inclusive language and visible symbols of support. 3. Having crystal clear, inclusive, non-discrimination policies. And 4. Actively fighting isolation by connecting people to their communities.
And this really shows that creating safety doesn't just start when the clinical care begins. It starts the moment someone even thinks about asking for help. Are the intake forms on the website using gender-neutral language? Are there visual cues like a rainbow flag that signal you're welcome here? Is the very first person you talk to on the phone trained to be competent and respectful? All these little things send a massive signal.
Ultimately, when you put all this work together, the research, the policies, the training, it brings us to this final, crucial question. This isn't just about avoiding harm or tolerating differences. It's about a fundamental shift. How do we build a future where our systems of care don't just see, but actually respect and even celebrate the whole person in all their complexity? That's the challenge, and that's the goal.